Welcome to our comprehensive guide on tinnitus.
Tinnitus, a common condition often described as a ringing in the ears, affects around 15 to 20% of people. Tinnitus isn't a condition itself, but a symptom of an underlying condition, such as age-related hearing loss, ear injury, or disorder in the circulatory system. In our today's video, we would be delving into both conventional and alternative treatments for quick relief. Moving on to the conventional treatments. Traditional methods of tinnitus treatment primarily involve therapy and medication. The most common therapy used is sound therapy, which uses external noise to alter the individual's perception of, or reaction to, tinnitus. Medications like antidepressants and anti-anxiety drugs are often used to alleviate the symptoms, but while they work for some, their effect is by no means universal. Now, let's switch gears and talk about alternative treatments for tinnitus. Over the last few years, alternative therapies like acupuncture, hypnosis, and herbal supplements like Ginkgo biloba have garnered a lot of attention in the tinnitus community. Although these are not recognized by all the doctors, a section of patients do find relief via these methods. Hence, it's always worth discussing these options with your doctor. While tinnitus can be a quite bothersome condition, there is certainly no shortage of treatment options. From sound therapy and medication to acupuncture and herbal supplements, a wide array of strategies can provide quick relief and improve the quality of life for sufferers. Always remember to have an open dialogue with your doctor about what might work best for you. Stay tuned for more such informative videos.